Hi everybody, just wanted to hop on and make a quick screencast for you about cranial nerves. We'll start off with a helpful device to help you remember all the cranial nerves in their order and by number and by name. So it goes, oh, once one takes the anatomy final, very good vacations are heavenly. First is olfactory, which is sense of smell. Second, optic, sense of sight. Oculomotor, eye and eyelid movement. Trochlear, which is the eye movement as well. Trigeminal provides sensation to the skin of the face and movement of chewing or mastication. Trigeminal, another way to remember it is that there's three branches, which is where the tri comes in, three branches of the trigeminal nerve. You have abducens, which is eye movement as well. Facial nerve is, excuse me, motor innervation of the face. This is one of the more commonly injured cranial nerves. Vestibulocochlear helps with hearing and balance. Glossopharyngeal is oral sensation, taste, and salivation. Vagus, which provides parasympathetic innervation of various structures, helps you swallow, things like that. Another way to remember vagus to distinguish between, oh, does it go with very or is it vacations? Is it number 10 or is it number 8? Is to remember that you can go to Vegas on vacation or go on vacation to Vegas. Accessory is motor innervation of the sternocleidomastoid, so turning your head, shrugging your shoulders. Hypoglossal is motor control of the tongue. First picture to start off with, I wanted to give you a numbered one so that you notice that from anterior to posterior, they're numbered in order. So the structures go in order. So if you forget the name, count from the top what the number is, and most likely you can remember the name if you remember which number. So first is olfactory, optic, oh my goodness, I'm spacing, oculomotor, trochlear, trigeminal, this is just the one branch here that you'll see, and all of the nerves will mirror on one side to the other. So trigeminal, abducens here in the middle, then facial going outward, and vestibulocochlear. Just below that is glossopharyngeal, and then the vagus nerve, the accessory nerves, which are down here, all these right here, and then the hypoglossal. This isn't a super clear picture once you get down here, but the later pictures that you're probably already familiar with, they'll be easier to identify. So we'll just go through these quickly again. I'll identify a couple structures and helpful tips to remember as we go through. Olfactory, you'll need to know the olfactory bulb and the olfactory tract. They can also ask you to identify the olfactory nerve from a superior view without the brain. So you'll be looking into the skull and you can see clearly where the olfactory nerve goes. Pretty obvious, but that's a slide I didn't put in here. You'll have the optic nerve. You'll need to know the optic chiasma or chiasma, however you want to say it. Optic tract here, oculomotor, trochlear, trigeminal, facial, abducens, facial, vestibulocochlear, glossopharyngeal is this little one right here. You can sort of see it peeking out on this side. This here, the highlighted one, is the vagus nerve, and then the accessory, and then we go back up to number 12, hypoglossal. So the hypoglossal looks like it's above the glossopharyngeal, but if you remember, if you turn the brain how it's supposed to look in the skull, then you'll notice that the hypoglossal, or hypo, meaning below, is below the glossopharyngeal. So that's one way so you don't get these two mixed up, because that can be tricky since they kind of sound similar. So hypoglossal is below glossopharyngeal. I wanted to show you guys a few of the slides of just the isolated midbrain and a couple of the viewpoints you'll need to know structures from, because it won't be just from this picture. You'll need to know other ones as well. This one, they can ask you every single nerve except for the olfactory, because it's not there. But, oh, sorry, every other one is visible in this picture. Structures you'll need to know from this lateral view of the midbrain is the trochlear nerve, the abducens here, the facial, the vestibulocochlear, and the hypoglossal. Other ones you can see from this view is, of course, the optic. There's the trigeminal right there. This one right here is going to be the glossopharyngeal, and then the vagus right underneath it, and the accessory. They won't ask you these down here from this view just because they're kind of hard to see and hard to distinguish between these two right here. So the ones they're going to ask you from this picture are right here. And then this is just another lateral view where they can ask you the vagus, the glossopharyngeal, and the accessory because they're easy to see. Vagus, glossopharyngeal, accessory. Of course, other ones you can see: optic, trochlear, trigeminal, vestibulocochlear. I think that's the abducens right there. Don't quote me on that. And the hypoglossal. But the ones you need to know in this picture are right here. I wanted to throw in this last slide just because this is the oculomotor nerve. This is one of the zoomed in views where it's easier to see the oculomotor, because from this view and this view, they're a little tricky to see, so they can ask you from this slide. All right, I think that's everything I have. If you have any questions, go ahead and ask. I'm always able to answer those, and good luck on your exam.